Hello, everyone, and welcome to the Good Love Podcast, a Good Love project production with your friendly neighborhood sex geek and good lover, Katrina Boots Rainsong. Here at the GLP, we strive for informed, enthusiastic consent, so this is your content warning. The Good Love Podcast is a sex and relationship education podcast directed to adult listeners. We offer playful, powerful, and positive education on sexuality, pleasure, kink, sexual health and wellness, and a slew of other grown and sexy topics. If you find any of these topics objectionable, you're welcome to skip an episode or even the whole show. If you're under 18, we recommend heading over to scarletine.com for all youth-focused sex ed needs. Now, if you're an enthusiastic yes, get comfy and enjoy the show. Welcome, good lovers. Happy Thursday. I gotta tell you, I live in the desert. It's hot, and I have to turn my air conditioning off when I record these, so I hope you all appreciate that I am sitting here in mostly darkness, because it makes it slightly more bearable. Sweating as I create these podcasts episodes for y'all. No, but I love it though. You all know that I love it. I love it, and I love all of you, and we suffer for our art. That's just what we do, right? So, as I sit here in this very warm, dark environment, getting a little wet, I'm going to talk today about vaginas. More specifically, I'm going to be talking about the common misconceptions that we have and that society has carried for a very long time about vaginas. So, when I originally wrote the blog post on this, I called it Vagina Myths, but I am moving away from using myths in this way, using it as a synonym for untruths or lies, because, well, for one, it definitely that can come from a place of colonialism, and we're trying to decolonize our languaging, and also because myths are powerful. I believe myths are important. They have valuable lessons. So let's not disregard myths, and let's not denigrate them. But we do, as a society, we do need to watch out for misconceptions, misinformation, misunderstanding. So many M's. Man, you all know my love for alliterations. I swear this one's not on purpose. But also, and here comes another M word. As a society, we tend to metaphorize the body. What do I mean by that? To metaphorize the body, we will sometimes look at someone's body, or even our own, but usually this is something that is done externally, and we assume things about the person based on what their body looks like. And this metaphorizing of the body is so long held, so insidious. We don't even realize that we're doing it sometimes. And once you start recognizing it in yourself and others, you start realizing, oh, wow, that's coming from a place of shame, fear, oppression. It doesn't feel good. It's gross. So, as we move forward, bringing light to some of these misconceptions, you're going to see where a lot of them are based in metaphorizing the body and how, with just the right information, we can dissolve all of this. So today, vagina misinformation, misconceptions, specifically about the misconception of the loose or tight vagina. So first, let's just dispel this whole idea of a tight vagina. And most of the time throughout this episode, when you hear me say the word tight, I want you to imagine me doing the finger quotes, air quotes, which, funny enough, if I was to turn my hand then palmward, that would be the motion I would use to use my fingers inside of my vagina. That's funny. So imagine upside down quotes if that makes you smile. But remember, I'm using quotes here because we're talking about a misconception. A happy and healthy vagina is a toned vagina. During a pelvic exam, a gynecologist or a midwife may check for vaginal tone. This is often done by inserting 2 fingers into the vagina. Oh, remember the inverted quotes movement? Just like that. And asking the patient to contract. What they are feeling for is responsiveness and strength of the muscular tissue. If the response is weak, muscular atrophy or a nerve condition may be an issue. The vagina can still feel tight even if the pelvic floor is weak. On the other hand, if there is pain or difficulty with insertion, then vaginismus may be the problem. And we'll talk more on that in a little bit. Kegels and other pelvic floor exercises are not about making the vagina tight, but developing strength, awareness, and control of the muscles. Think of it this way. Your shoulders. When they're tight, it's likely because you're stressed. You don't hit the rowing machine at the gym to get tight shoulders, but toned shoulders. Same with the vagina and the pelvic floor. A tight vagina is not a happy vagina. Why are we so obsessed as a society, as a culture, with tightness? Well, this is where that metaphorizing of the body comes in. We associate tightness with virginity or sexual purity. Calling someone loose carries the double entendre of implying loose morals, as well as referencing the misconception that frequent sex, which doesn't get compared when that frequent sex is only with one partner. So there's a weird double standard there. But frequent sex with many partners is believed to lead to a loss of vaginal elasticity or tone. Let's set aside for now that virginity is a social construct. That's a conversation for another day, and it will be had here. Let's also set aside that no one can agree how much intercourse or how many partners are enough or too much. The plain fact is, if the vagina can bounce back after pushing out a baby, no penis, hand, toy, whatever is going to leave it permanently stressed out. Tightness is also associated with youth. The misconception kind of goes hand in hand with ones around virginity or even childbirth, which we'll get to in a minute. It's assumed that younger people have had less sex and have not given birth. and thereby are tight. It is true that as we get older, the pelvic floor muscles can lose some strength and elasticity, regardless of how much sex you've had, whether you've had children, or even whether you have a vagina or a penis. You cannot tell the state of one's genitals or any part of their body just by looking at them, their age, etc. Another reason that tightness gets associated with youth is this misunderstanding from a visual standpoint based on vulva or labia appearance. A tight vagina is often symbolized by a closed vulva, i.e., a vulva in which the labia minora is hidden within the labia majora. And even those names kind of feed into that a little bit. Labia minora, the inner lips, it makes it sound as though they are supposed to be minor, hidden, tucked away. And the labia majora, outer lips, are supposed to be the bigger. So, and that's just not always the case. The length, thickness, and color of your inner lips has nothing to do with the width, depth, and elasticity of the vagina. And while we're in here talking about vulvas and vaginas, I'm going to take this moment to remind everyone that the vagina is what is on the inside, and the vulva is the exterior. So the labia, the mons, the clitoris, all of that is the vulva, not the vagina. And I believe that this common practice of using the word vagina to refer to the vulva is another factor that contributes to a lot of these misunderstandings. Of course, one of the most widely talked about and prevalent of these misconceptions is that around childbirth, and childbirth ruining, and again, I hope you're hearing these, the finger quotes here, ruining the vagina. We'll be honest, childbirth causes changes to the body, including the vagina. Some changes are permanent and some will go back to pre-pregnancy state eventually. After childbirth, the uterus and vagina take about 6 to 8 weeks to return to their previous size and shape. The appearance of the labia can also change due to hormones and increased blood flow. This also mostly changes back eventually. Nothing is ruined. It may just be a little bit different. This idea of childbirth ruining the vagina has led to some pretty awful medical practices, including an overuse of episiotomies and the horridly named husband stitch. These practices claim to preserve or repair the vagina's sexual function and aesthetic, but can actually often lead to worse sexual dysfunctions later in life. So it can possibly lead to some other questions. All right, we've dispelled with the idea of looseness and about tightness, but is there such a thing as being too tight? Yeah, there is. Vaginismus is a condition in which the pelvic floor muscles spasm, causing pain and making penetration difficult, whether it's sexual penetration or even tampon insertion. There are a number of reasons why this can happen, ranging from physical causes such as a urinary tract infection or post-operative complications, particularly for trans women with neovaginas, which is why dilation is a thing, to emotional triggers like past trauma. So I'll say it again for the people in the back. A tight vagina is not a happy vagina. So what about all of these tightening creams, gels, and other so-called treatments that are out there? Well, most over-the-counter topical treatments that claim to tighten the vagina, first off, they're not FDA approved and they're not regulated. So think about what you might be putting up in a very sensitive area of the body. Furthermore, many of them work by actually drying out and irritating the vaginal mucosa, bringing a temporary feeling of increased tightness. But what is actually going on is an inflammation response. Regular use can affect your natural pH balance, causing further irritation and possible infections such as an overgrowth of candida, which is a yeast infection, or an imbalance in your natural bacterias, BV, both of which are not fun, are very unpleasant. One of the main ingredients in a lot of these tightening creams is something known as oak gall, which is basically powdered wasp nest. So please don't put wasp nests in your body in any way. What about the labia? We've already talked about the fact that the appearance of the labia does not signify anything about the tone of the vagina. And yet we still have this discomfort around the look and size of our labia. Asymmetry is normal. Everyone is different. And that's totally okay. But what about if it's really too big? Look, the labia have a job to do. They protect the vaginal opening and the clitoris from friction and impact. Labial hypertrophy, or enlargement of the labia, during puberty and or pregnancy is generally normal. In a few people, it can cause physical discomfort, typically from friction. Most doctors will typically recommend wearing natural fibers and loose clothing in these cases. It is very rare to need surgery for such a condition, and the majority of labiaplasty is performed for cosmetic purposes, not medical. And these cosmetic purposes circle right back around to tightness being connected with closed labia, being associated with youth, being associated with purity, sexual purity, or virginity. So, if you're concerned about your pelvic floor tone or your vaginal health, talk to your gynecologist or your midwife, especially if you're experiencing pain or numbness. There are exercises and physical therapy to build strength or relieve pain and tension. And there are pelvic floor physical therapists out there that can help you with that. It's covered by insurance. So I know it can be difficult sometimes to talk to doctors about sexual matters, but for your own health and quality of life, talk to your doc. Get that referral. And that goes for those of you who have penises as well. Pelvic floor health is also for you. Yes, you can do Kegels. Yes, you can see a pelvic floor physical therapist if you're experiencing pain or any kind of dysfunction. That's going to be a wrap for me for today. Were there any misconceptions or misunderstandings that I missed? common things that you grew up with hearing, if there are, and you'd like me to look into them and talk about them here on the podcast, feel free to send me an email at goodloveproject@gmail.com. And we tackling other misconceptions and misinformation in future episodes. We're going to talk about misconceptions about the penis, about orgasm, and I'm very much looking forward to an episode on the very, very messy history of, quote, intimate hygiene. Thanks for listening, my good lovers, and especially to all of you that have subscribed. And until next time, keep on good loving.